Hi guys, I'm Kirk Smulligan and this is my MedTurn project. This first article is about osteoarthritis. This article talks about which age group of people usually have osteoarthritis, what they experience having osteoarthritis, and the different treatment options. The most common age that people have osteoarthritis is 65 and older, and they experience joint pain which agonizes their joints mainly while they are being active. But there are many different treatment options for them. First, they're directed down a non-pharmacological route, which includes exercising, weight loss, and physical therapy. The second route they are directed down brings them to a pharmacological route where they can use several types of drugs or steroids to help relieve the pain. And lastly, they can go with a surgery route where or an implant is put in, which works 95% of the time. The reason I chose this topic is because my grandma has osteoarthritis in her hand, and I wanted to know more about how it affects her and the different treatment options that she has. It was very interesting to me to find out that pretty much osteoarthritis affects people 65 and older. Like, I knew it went along with aging, but the article said that it pretty much has a big spike of increase after the age of 65. And one point of knowledge that I gained was that both opioids and corticosteroids are used to help relieve the pain, and I knew they took different medications, but I didn't realize that they could take opioids or corticosteroids. The second article discussed the acromioclavicular joint, or the AC joint, and the coracoclavicular ligaments, or CC ligaments, that are around the AC joint. The AC joint is formed by the cap of the shoulder and the collarbone. The AC joint is also strong, but its location makes it vulnerable to injuries. There are 6 different types of AC joint injuries. Type 1 injuries involve a sprain or partial tear of the AC ligaments. Type 2 involve a complete tear in the AC ligament and a partial tear or sprain in the CC ligaments. Type 3 involve a complete tear in the AC and CC ligaments. And then types 4, 5, and 6 are all very severe and usually require surgery to heal. To treat a shoulder separation like an AC joint sprain, ice works very well, as AC joint is superficial. Also, drugs such as Tylenol, ibuprofen, or Aleve can be taken to lessen the pain. Injuries of type 1, 2, and 3 usually require ice, rest, time in a sling, and physical therapy doing range of motion exercises as soon as the patient can to help heal them. And as each level goes up, each type goes up, so does the severity of the injury, meaning that it takes longer to heal. And then, as I said, types 4, 5, and 6 usually require surgery for healing. The reason that I did this article is because I had an AC joint injury last year as a result of a sports injury, and I wanted to learn more about what causes AC joint injuries, and also what level or type of how high the severity of it was that I sustained. I found it interesting that a lot of times, along with the injury to the AC joint, the CC ligaments were also often injured. And the thing I learned from the article was that my injury was classified as a type 1 injury on the scale from 1 to 6. My third article is about Meniere's disease, a disease that affects the inner ear, and the problems that people experience with Meniere's disease. Scientists believe that Meniere's disease is caused from changes in the fluid levels in the inner ear. The most common symptoms include vertigo or dizziness, ringing in the ear, and ear fullness. Doctors will put people through a series of tests to decide if they have Meniere's disease or not. Tests such as hearing tests and balance tests. Meniere's disease is a chronic condition that has no cure, but there are several things that can help make the effects of the disease not as bad. Doctors may first prescribe a motion sickness pill for patients to help with the vertigo, or a diuretic to help lower the amount of body fluid. Some people may need the help from physical therapy, surgery, or hearing aids to help with their hearing problems. One of the biggest things people with Meniere's disease have to deal with is a diet change, especially with their amount of sodium and alcohol intake. Resting during vertigo attacks, eating healthily, and managing stress are other ways to help manage the side effects from Meniere's disease. The reason that I did this article is because my mom has Meniere's disease, and I wanted to find out more about why it happens and the side effects from it. I found it interesting that people can get surgery to help the problems and also can get physical therapy. Some knowledge I gained from this article would be that learning that what a diuretic does, which it reduces the amount of fluid in the body. My mom had told me about the diuretic she takes, and she told me that it makes her go to the bathroom a lot, and I wasn't really sure why that does, but now I know it's because it reduces the fluid in her body by flushing it out, so that's why it made her go to the bathroom a lot. And with her condition, she especially was affected by vertigo, and she is on a low sodium diet, so she has to eat a small amount of salt every day to help the side effects not be quite as bad for her.